Hello, I'm Coy Alexander with Ritehomes. I'm here with Dr. Megan Fitzpatrick of Kern Radiology. In support of Breast Cancer Awareness Month, I asked her to stop in and talk to us a little bit about what women can do to help prevent this disease. So Dr. Fitzpatrick, tell us a little bit about breast cancer and what women can do to help prevent.
So there are several established risk factors for developing breast cancer, many of which we cannot change. Being a woman in and of itself is a risk factor for developing breast cancer. Aging is a risk factor. Genetics, family history, those both play a role. We obviously can't change those sorts of things. But there are some things that we can do as women to lower our risk of developing breast cancer. Maintaining a healthy lifestyle, maintaining a healthy weight, regular exercise, limiting alcohol, not smoking. These are things that can lower our risk. If a woman has the opportunity to breastfeed, that can lower her risk. Avoiding prolonged hormone replacement therapy is also something to consider. So to answer your question, there are things we can do to lower our risk of developing breast cancer, but there's no real way to prevent the disease entirely, which makes screening and early breast cancer detection so important.
Okay, great. And that's usually through mammograms, is that correct?
That's correct.
And can you explain to the audience a little bit about a mammogram, what it is, does it hurt, how long do they take? 'Cause I hear that a lot, sometimes
Sure.
they may hurt.
Sure. So a screening mammogram is basically an x-ray of the breast tissue. It's an image of the breast tissue that the breast imager then interprets, looking for any suspicious findings that may be indicative of breast cancer. It's a screening tool used by radiologists to detect breast cancer as early as possible. The whole exam takes about 30 minutes. Each image of the breast is acquired very quickly by the machine. Usually a screening mammogram uses 4 images typically, 2 of each breast. But there's some time involved in repositioning the patient between each image acquisition. The potentially uncomfortable part of the exam is the compression. The breast tissue has to be compressed adequately in order for a quality image to be produced. Some women are more sensitive to this depending on their level of tenderness. So if you're particularly tender, you may want to try to schedule your exam when that's a little bit less intense. But I just encourage all women to verbalize to their technologist how they're doing. Every technologist is going to try to make the exam as comfortable for the patient as possible while ensuring a quality exam.
Okay, perfect. And how long does the exam usually take?
It usually takes about 30 minutes.
30 minutes, so pretty quick. You're in and out. And you're
Pretty
good to go.
quick, yes.
Okay, great. Are there any things that home women can do to help check for themselves in between mammograms?
Yes, so I just encourage women to know their own breast tissue and monitor for any change. So if there's any change that's concerning to you, particularly a lump, bring that up to your physician and come to us for a diagnostic exam so that we can evaluate.
Okay, great. So just keep an eye on those type of things. Great. I have a question for you. Is breast cancer hereditary?
Sometimes it is, not always, but it's believed that about 5 to 10% of breast cancer cases are hereditary, meaning they result from a genetic mutation that's passed down from parent to child. So genetic counseling, genetic screening can be performed, but it's not right for every woman. If you think this is something you're interested in or would be helpful for you, then talk to your physician about it.
Okay, great. All right, well, there you have it, folks. This is Dr. Megan Fitzpatrick with Kern Radiology, talking a little bit about Breast Cancer Awareness Month. If you have any questions, please call in to Kern Radiology or visit their website if you have any other questions. Thank you so much, Doctor. I appreciate your time.
Hi, I'm Dr. Megan Fitzpatrick. I want to thank Coy Alexander with Ritehomes for partnering with us during Breast Cancer Awareness Month and helping us help the women of the community during this very important time.